Jacob and Jared from Marble City Pharmacy joined us this morning, and we have awaited your arrival with bated breath, of course. On
A lot of anticipation, yeah.
I don't want to smell your breath.
Well, I did brush this morning and floss and wash, but asthma and COPD, our topic today, and boy, that touches a lot of people, doesn't it?
Yeah, asthma, COPD, some of the most common things we see at the pharmacy, right? You know, 2 chronic breathing disorders that make it difficult for you to get air. And as you might imagine, that causes anxiety, of course, and a lot of problems. And so we want to get to those today.
I have been, over the years, have had the breath knocked out of me. And you're trying to breathe, but think about this as a constant. You know,
I remember, I generally, disclaimer, I generally don't care for drug company commercials on TV, but every now and then there'll be one that's really good that helps people understand. And there was several years ago, I don't remember the drug now, an advertisement for an asthma medication, and their tagline at the end was, when you can't breathe, nothing else matters.
Yeah.
And you know what, I've kept that, I've said that 1,000 times, people trying to understand asthma or COPD, because when you can't breathe, nothing else matters.
All right, let's talk about asthma first of all this morning.
Yeah, asthma is just a condition where there's swelling in your lungs, basically, in the pathways in your lungs, and it makes it more difficult to get air. And so this usually happens when in kids and younger people, right? Sometimes it stays with a person for the rest of their life. Sometimes a person grows out of it is not the right term, but sometimes a person, as they get older, don't experience any more symptoms. There are times when asthma is worse. A lot of times, some people have only exercise-induced asthma. Got one of those right here. Sometimes people have asthma only when they're exposed to certain allergens or things that cause allergy symptoms, right? And then some people have asthma only when they're exposed to certain chemicals, maybe like smoke. And so asthma can be a condition where people experience symptoms every day, or it can be a condition where people only experience symptoms when they come in contact with one of those 3 things or exercise like we just mentioned. And then there's the issue of an asthma attack. That can be a sometimes very, very serious medical emergency where a person simply cannot get air. And as Jacob said, in a serious way, that's a medical emergency, of course, that requires treatment at the ER.
What about some of the causes?
Well, but that's what he was just talking about, the triggers, the exercise, the allergens, the pollutants, the whatever. Each person's different. Whatever triggers yours, those are your causes. We don't know what makes one child or adult get it and one child not get it. That we don't know, and I don't know that we ever will. But so we have to deal with, if you have it, then what are the things that cause yours to act up, to come to light? Different thing. I remember growing up with kids that had it really bad. This one we can't go do this with this kid because I know what's going to happen, and he's not allowed to. And so your causes are, we don't know what causes you to have it. We have no clue. We just can learn what causes yours to act up, for lack of a better term, to become active at the time.
Sure.
So are there pretty obvious symptoms of this?
Yeah, you think traditional, and you guys have heard this before. You got the wheezing. A lot of times you hear this. Wheezing is one of the hallmark symptoms of asthma in kids. It's the whistle sound when a child makes a breath. I'm not going to try to do it here.
Please don't.
On the show. You don't think I should?
We've already talked about Jimmy Dale's breath. I don't want to be next to him.
No, you're too close to him.
So you got the wheezing, you got the shortness of breath, you got the coughing. Those are basically the hallmark symptoms right there of asthma.
So how's this treated?
Treatments, and this, of course, that's what we're here for. We're the pharmacists. That's where we lean. Let's do a couple of things for asthma that are less treatment, more common sense. If my asthma is triggered by a grass allergy, let's not go wallow in the grass. Right. Let's know our triggers, what makes mine worse, and work around them. Now, I'm not going to tell anybody to avoid exercise. But if exercise is your problem, exercise-induced asthma, you have to prep when you exercise by taking certain medications before you do it. So know your triggers, avoid them as best as possible is treatment number 1. Don't make it worse. Treatment number 2, medicines. We have lots of them. Mostly inhalers, obviously. Let's not give something to the whole body when the problem's right here. If we can get directly to it, we take an inhaler. And so you've got inhalers that open up your airways by relaxing the muscles and things around it. They open up that tree in there, let you get more oxygen in and out. They're called bronchodilators. There's a couple of different ways that we go about that, different classes of drugs. And then there are drugs that get rid of the inflammation from within. Those are steroids. But very important, if you get nothing else from anything any of us says today, hit me with this one. Stay with me here. You will have medications you are supposed to take on an everyday basis. You take this inhaler X number of times a day, every day, no matter what you feel like. You won't feel anything immediately from that. It doesn't magically, quickly, right then open up your airways. That is what we call a maintenance medication. You take it every day. If you do that, you way less of the time have to resort to what we call your rescue medications. You will have another inhaler that is your rescue inhaler. When I'm having a symptom, when I can't breathe, when I'm struggling, you pump that rescue inhaler to hopefully get it to go away. You don't rely on the rescue inhaler all the time and ignore your other. Well, I don't feel anything when I take the other one. Right, that's not what it's for. It's to prevent you from getting worse. You take that every day. You don't ask questions. And then only the rescue inhaler when you are struggling. We have way too many people that only get that rescue inhaler and wonder why they have to use it 20 times a day and I can't breathe. Would you take your regular stuff? No, I don't feel anything when I take that.
Now, which is prescription, which is not?
They're all prescription.
Mm-hmm.
They're all prescription. But yeah, you'll be set up with everyday medicines and rescue medicines. Just know which ones are which, and don't give up on the everyday medicines just because when you puff it right then, you don't feel an immediate release of something. Take it every day, and your treatment and your overall prognosis is much better.
I can read my notes this morning, and this is not in the notes, but
that's first.
What about Sylacauga, Alabama? Is there a lot of asthmatic people in our community?
There's a lot of asthmatic people in this community, a lot of asthmatic people in this state. One of the reasons for that would be because, and you know this, we have a lot of particularly seasonal allergens in Alabama. Allergy season in some states lasts just a few months in the summer. Allergy season in Alabama is probably from
13 months a year.
Yeah, I mean, it's probably February to November. No joke. As a person who has seasonal allergies, I can tell you that from experience. And so I'm not saying that we have more asthma, but we may have more asthma attacks and more asthma symptoms and incidences than you might see in other states just because our allergy season is that much longer.
To be honest with you, I hear more about COPD than I would asthma. So let's talk about COPD this morning. It can be a very, very serious...
That's because in people your age, it's more common. Is that fair?
True.
No, it's not fair. It's my show.
It's true, but you didn't have to say it.
No,
There's
you
a
didn't
difference.
have to say it.
Yeah, there's a difference in something that's true and something you need to say.
Go ahead.
COPD. All right, what is that? Let's spell it out. Chronic obstructive pulmonary disease. It's exactly what it says. It is an inflamed lung condition that's always inflamed. Mm-hmm. Okay, that's what those four words mean.
Is that what chronic means?
That's what chronic, always. Okay, it's persistent. It keeps going.
It's an educational show.
It is.
I mean, nothing gets better. Right? I can spell just barely. All right, so causes of COPD. First of all, two types, emphysema and chronic bronchitis. The treatments are the same, the symptoms are roughly the same, but it's classified based on where your main problem is, in case anybody was curious what emphysema and chronic bronchitis were. Those are the two forms of COPD. Almost always, not always, but almost always caused by smoking. Let's just call it. Mm-hmm. It's caused by long-term smoking. Mm-hmm. It can be caused by pollutants, workplace. If you work in a career where you scraped asbestos for your entire career, okay, you have COPD. There are other causes, but for the most part, in civilized nations, for the most part, it's smoking. There's your, if you want to attack one thing, it's smoking.
Is that long-term smoking?
Absolutely.
Yeah. Long-term smokers, develop COPD at a much higher rate than the normal population. Which normal population develops it, if you don't smoke, and don't have a job, scraping asbestos or using harsh chemicals, your chances of getting COPD are roughly 1% because there's a genetic component to it. But if you do smoke or working with those, your chances are very high.
So basically, it's older people.
It really is, and that's one of the truth is there are a lot of similarities between asthma and COPD, but one of the things that you see is you don't see COPD in young kids, whereas you do see asthma. And as you get to the older population, you do have some people, like we said earlier, that asthma persists throughout their entire life. But generally speaking, you see a lot more COPD in the older population. And just to add to what Jake said, a lot of the symptoms actually between asthma and COPD are the same as well. But a couple of things you see with COPD patients, particularly those who have chronic bronchitis, you see increased mucus production by the lungs. And so you see a lot of these people that are constantly having to cough up mucus from their lungs and get rid of that just so they can breathe. And then you see people who are way more susceptible to whatever respiratory infection is currently going around, right? So if you think about it like this, if you have increased mucus in your lungs, bacteria, viruses, they love that environment, right? And so you have a person who's more susceptible to whatever it is that's going around at the time. So these people have continual infections, right? And as opposed to asthma attacks, right, that a person with asthma might have, people with COPD have something that were called exacerbations.
Nailed it. Good.
Similar thing, actually, and that is just, this is a period of time where my COPD is worse. And a lot of times that person will have to get oral steroids for maybe a 5 to 7 to 10 day course to beat down that exacerbation and get back to where they can breathe normally again.
So, older population, you mentioned whatever illnesses or viruses are out there, and that points us back to COVID-19.
Yeah, I mean, it does. Yeah, you know,
Sure.
We keep reading, you're much more likely to have struggles with it if you have underlying causes. Well, what are underlying causes? Hey, there's number one right there.
Yeah.
COPD. And so, you are going to catch what's there. And it's one of those things where, you can always try to make things better later, but once you've done the damage for years and years, you go, boy, I wish I hadn't done that.
Yeah.
It'd be nice if you could go back, but you can't. And so, let's avoid it while we can. Let's do what we can now. But it definitely leads to that.
So we touched on it just a minute ago, but let's talk more in depth about the treatments for COPD.
A lot of treatments for COPD are similar to the ones that are available for asthma. There's not to get crazy with this, but there's a third category of medications that are more used in COPD than they are for asthma. They still come in inhaler form. There's no need for you to memorize that on this show. There are still,
because we don't remember anything more about it.
There are still daily inhalers versus rescue inhalers in COPD, just like asthma. Jake's already explained that. Let me tell you the number one thing you can do if you have COPD, though, and that is stop smoking, right? Unfortunately, a lot of our patients with COPD have smoked for decades. And it's just something that they cannot stop.
It's an addiction,
It's an addiction. Yeah. It's difficult to stop. I'm not making light of that at all. If you've been a person who's smoked for a long time, it's not easy to stop. But if you want the number one way where you can make your symptoms get better, where you can have a better projection for the rest of your life as far as your breathing goes, stopping smoking is it. So get the help that you need. Ask us. We'll direct you in the direction of the help you need to stop smoking. Number one thing you can do.
And Jake, it's not just for that individual, it's for their families as well.
Yeah.
Well, and I failed to mention this earlier. We were talking about, things that trigger and cause asthma, and we hit on a couple of things, but I've talked to doctor friends that have had this conversation with moms and dads before. Your 6-year-old kid is in the ER for the third time in the last 2 months, asthma exacerbation. Can't help but notice an odor. You guys smoke in the house? Yeah. Mm-hmm. That's why your child is suffering right now. I need you to quit smoking. Now, let's not make light of it. Sometimes even with that before you, as you're doing this for your child, it's still not easy to quit. It's very difficult. Again, we're not making light of that. It's very difficult. But so from the time you're young to the time you start having kids to the time you're moving on into adulthood and older ages, there's nothing good coming from this smoking. You're exacerbating other people's asthma. You're causing yourself to have asthma triggers. You're developing long-term COPD, emphysema, chronic bronchitis. All these things are going on. Stopping smoking stops this cycle way back at the beginning. And it's difficult, but it needs to be done.
And I'm sure it could be frustrating to pharmacists as well, because we have people who have smoked for decades, as you say, and they see it before them, but convincing them is another thing.
Well, it's interesting. It's very difficult to convince somebody to stop doing anything, right? I mean, whatever it is that your bad habit is, or mine, or Jacob's.
And you're enjoying it,
It's very difficult.
I don't have any bad habits.
I will tell you that as a pharmacist, all we can do is to help people where they are. They teach you this fancy, what do you call those abbreviations?
The motivational interviewing stuff.
Whatever it's called. They teach you all this stuff in pharmacy school about how you can't get a person from this point to this point. That's not your job. But you're going to encourage somebody wherever they are. And I kind of like that, because if a person knows they need to quit smoking but they don't want to, you can't do anything with that, right? You can show them all the literature in the world. You're going to die earlier, and you're going to have heart problems, and you're going to have COPD. If they don't want to quit, they're not going to quit. So what we try to do is meet people where they are. When somebody expresses the desire that they know they need to quit and they want to, then that's the time where we try to help them. Point them in the direction of this medication that's over the counter that can help. Write down the name of a prescription medication that they can ask their physician about that will help, and give them the support that they need.
All right. Jake, closing thought.
Closing thought. It felt good to talk about something other than COVID today.
Yes.
Because as all this is going on in the world around us, people still have all these other diseases we've historically come on this show and talked about, and they're still struggling with them. And so it felt good to get back to something normal. But, again, if you're out there, asthma, COPD, we can help. We can help explain your medications. We can help explain what we're trying to accomplish. Come talk to us about it.
All right. Thank you both for being here this morning.
Yes, sir.
Sir.
We've got more Daybreak just ahead.